The title of today's lecture is called Blood, Channels of Resurging and Longevity, Blood Tests. So there's a subtitle to the subtitle. Blood, Channels of Resurging and Longevity, Blood Tests. I'm going to be talking about the function of the blood, what's carried in the blood, and then blood tests and what the blood tests mean. I'm going to particularly make a distinction between a normal range in your blood test versus optimal. Make a big distinction between normal, being within a normal range, versus optimal. And you always want to go for optimal. And I'm going to give you information also as to how to put some of those markers in an optimal range. Not just normal, but optimal. And in doing so, I've kept my blood workups for the past 20 years. So that's the first thing I want to suggest. First thing I want to suggest, whenever you have a blood test, and you want to get them at least once a year. As you get older, you might need it more often. And you want to save them. You ask for the results. I have the results of years and years of blood workups. Very important. Why? You want to get a baseline, because then if there's a change, you know there's something you need to look at. For example, let me talk about men for a moment. Men typically start getting the PSA readings, which is a marker for prostate cancer. Start getting those maybe age 40, get those regularly. Now let's say a man, you're getting your baseline and you see every year your PSA is 0.5, and it's good. Normal. Let's say the man's PSA, you see each year it's a 1. It was always a 1. That's good. And let's say man has a 1, his PSA is 1, 1, 1, each year comes in 1. Then one year, it's a 2. Well, it's still normal range. So if you just look at that 2, say, well, it's no problem. So if the doctor didn't see the 1, and usually they don't look at past ones, and if you had it, you probably don't even remember. As a matter of fact, your doctor probably didn't even give you the numbers. He probably just told you everything's fine. Yeah, that's what the patients hear. Oh, everything's fine. They don't even know. Don't settle for that. Do not settle for everything's fine. Always get your printout and save it. An absolute must. So here's an example where it could be life-endangering not to. So for a man, in a man's case, he's always had a 1. Now all of a sudden it's a 2. It's still normal range. It's below 5. It's fine. But it doubled in 1 year. See, that could be, he might have prostate cancer. So it's not just the absolute number, it's the change. Or let's take thyroid functioning, which applies, more women have more thyroid problems than men, but men have it as well, including myself. Let's say the normal range is 0.5 to 5. But we know that the optimal range is 0.2 to 2. So by keeping track, let's say you are having 1, a TSH of 1. No problem. Then a couple of years go by, you get a blood test, and it's a 3. Normal range. The doctor's not going to say anything. He says, oh, everything's fine. It's not. It went up from 1 to a 3. Could be the beginning of a thyroid problem. You might have Hashimoto's disease, or you might need certain food supplements. It may be in poor health. If it's a Hashimoto's disease, it could be a problem. That's where it's an autoimmune disease where you start to lose your thyroid. It went from a 1 to a 3. So what did the doctor tell you? Everything's fine. It's not fine. He probably didn't compare it to the other one. It's not fine. Now, for your thyroid health, if you start seeing it's changing in a way that's negative, you want to get your iodine up. Usually there's an iodine deficiency, and you want the amino acid L-tyrosine. L-tyrosine. Those are two that are very good for your health. The iodine source could be iodized salt. You can get kelp Or you can be eating crabs, lobster, and shrimp. You can also get iodine that way. Or seaweed, but you want to be getting your iodine. It's good to just do for your thyroid, period.